Assalamu alaikum dear students. Today we are going to start with the development of the respiratory system. So in the first lecture we have discussed the development of the trachea and the larynx, and now we are going to discuss with development of the lungs. So development of lung divided into 5 phases. The first phase is embryonic phase, which is from 3rd to 7th week of development. Second phase is pseudoglandular phase, which is from 5 to 7 week of development. The third phase is the canalicular phase, which is from 16 to 26 weeks. Then the saccular or alveolar sac phase, and last phase is the alveolar phase. So we will discuss each of the phases separately. First is the embryonic phase. The embryonic phase, as the lung development occurs, lungs grow distally and bulge into the medial wall of the pericardio-peritoneal canals. The splanchnic mesoderm, which is present over here, develop and differentiate into smooth muscle cells, and these smooth muscle cells then line the developing bronchial tubes as well as the developing blood vessels. Later on, the angiogenic mesenchyme form the extensive capillary network over here in this area, and the blood supply for the developing lung is derived from the 6th aortic arch. And this embryonic stage, there are the lobar or secondary bronchi are formed, and the bronchopulmonary segments develop. So in the pseudoglandular phase, the separation of the lung from digestive system is completed. At this stage, the development of lower conducting airways and appearance of acinar structures occur. This phase usually occurs 5 to 16 week of the gestation. The branching continues to form the terminal bronchiole. Primitive ciliated cells usually present at 7 week of gestation, and basal cells are present in the airways at nearly 11 week of the gestation. Mucus glands appear in the submucosa in the 12th week of gestation, and Clara cells also appear in this phase. So pseudoglandular phase, which is 5 to 16 week. It starts with the separation of the lung from the digestive system, and it ends with the formation of the terminal bronchiole levels. So after this, the canalicular phase started from the 16th week to the 26th week of gestation, and during this phase 2 to 3 more generation of branching system occurs. The terminal bronchi now divide into respiratory bronchi, and the respiratory bronchiole then form the alveolar ducts. In this phase, there is increase in vascularity. Also, the primitive cuboidal cells which are lining these alveoli, they develop into type 1 and type 2 pneumocytes in this phase. So canalicular phase from 16 to 22 week of the gestation, 2 to 3 generations of branching, and mainly the respiratory bronchiole and alveolar ducts are formed in this phase. The next phase is the terminal sac phase or saccular phase. This phase starts from 26 weeks till birth. In some book it is also mentioned till 36 week of gestation as well. In this phase, the formation of the primary bronchi occur, and these primary bronchi develop an intimate contact with the developing blood vessels and capillaries, and there is the formation of blood air barrier in this phase. So in this phase, there are the development of the alveolar sacs. Next is the alveolar phase. It starts from 8 months till the early years of the childhood. There is complete development of epithelium and maturation of the endothelial cells of the capillaries. So in this diagram, you can appreciate the Clara cells present over here, the type 1 and type 2 epithelial cells lining the alveoli. These are smaller capillaries present, and in this section you can see large number of alveoli are present. This one is the respiratory bronchiole. So different stages of the maturation of the lungs. The first, the pseudoglandular phase, in which you can see the different 2 to 3 divisions of the bronchioles. Then the canalicular phase, in which respiratory bronchioles are present. Then the terminal sac phase, in which terminal alveoli or sacs are formed, and alveolar phase, in which alveoli develop or acini develop in this phase. So lungs before and after birth. Before birth, the lungs are half filled with the fluid. There may be little protein in each, and mucus and surfactant is also present. Aeration of the lung at birth is replacement of intra-alveolar fluid by air. During delivery, some fluid expelled via bronchi and trachea and remaining is absorbed to the blood vessels which are present in close vicinity to the alveolar sacs. So when respiration begins at birth, most of the lung fluid is absorbed by the blood and the lymphatic capillaries. The surfactant which is present in this fluid remains deposited as thin phospholipid coating and alveoli, and in this way it decreases the blood air surface tension in these alveoli. So the anomaly associated with the development of the lung, the most common is the respiratory distress syndrome, also called previously as HYALINE membrane disease. This disease affects 2% of the live-born newborn infants, with prematurely born being most susceptible. 30% of all neonatal disease results from the HYALINE membrane disease or its complication. So in this disease, usually it affects the premature infants in which surfactant is not produced in sufficient amount, and at birth when the fluid is absorbed by the capillaries which are present in these spaces, as the surfactant is not produced, so blood surface air surface tension increases and there will be the collapse of the acini, which will lead to the asphyxia and the distress syndrome in the newborn babies. So HYALINE membrane disease most common in premature due to immature type 2 alveolar epithelial cells, and there is deficiency of the surfactant. Its onset is usually less than 2 to 5 hours after birth. It increases in severity from 24 to 48 hours, and then there is a gradual improvement after 48 to 72 hours. Abnormal retraction of the chest wall, the cyanosis, and the expiratory grunting and increased respiratory rate are the signs which can be observed clinically in such babies. Other anomalies may be the agenesis of the lung, there may be hypoplasia of the lung, there may be ectopic lung lobes may be present, or sometimes congenital lung cyst may be present due to dilation of terminal bronchi at certain levels. So here are the references. These are taken from the Langman's Medical Embryology and the Gray's Anatomy. Until the lecture of today ends over here, and I thank you all for your attention, and till the next lecture, Allah Hafiz.